What's up, everyone? Welcome to the first installment of Medicine with Mitch, where today we're going to be tackling a very light and basic topic in respiratory physiology, lung volumes, and lung capacities. Now, right off the bat, looking at this stuff, it may seem a little bit intimidating where there's graphs and pictures and the capacities are different things added together, and what's going on, who knows. But I promise you, it's really not that complicated once you break it down into its fundamental components. I do want to mention before we dive in, I'm not going to focus so much on the numbers, but rather the concept of the lung volumes and lung capacities, as once you can get the concepts, the numbers kind of follow, and you'll see what I mean later. There are 4 lung volumes and 4 lung capacities, and the thing to understand is that the lung capacities are just sums of the different lung volumes. So it's really important to understand the lung volumes and know them like the back of your hand. The 4 lung volumes are tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. And among the 4 of these lung volumes, the tidal volume is probably the most important one to know and remember. And it's probably one of the easiest ones to remember, as your tidal volume is just your normal quiet breathing in and out. The inspiratory reserve volume is the amount extra that you can breathe in from the tidal volume. So what this means is when you take a normal breath in quietly, after you take that breath in, you inhale deeply and forcefully, and you get all of that air into the alveoli within your lungs. The expiratory reserve is just the inverse or the opposite of the inspiratory reserve, and it's the amount extra that you can breathe out from your tidal volume. So again, what this means is when you take a quiet breath out and exhale, you really force all the air out of your lungs. And the residual volume is just any air left over after the maximal effort of exhalation. So at the end of your expiratory reserve volume. And this makes sense because not only is it in the name residual, it's kind of left over, but also you can't breathe out all of the air within your lungs because your lungs kind of have to stay inflated for us to be able to breathe and function as human beings. Now, taking a look at the 4 lung volumes from a graphical representation, on the x-axis we have just arbitrary time, and it's not really important. What you want to focus on is the y-axis, which is the volume of air within the lungs. As you go higher on the y-axis, you have more air within your lungs, and this represents inhalation. And then as you go further down on the y-axis, you have less air in your lungs, which represents exhalation. Now, if we take a look at our 4 lung volume definitions from before, we go to our trusty tidal volume, which is just our normal breathing. It's gentle amounts of air going in and out of our lungs, represented by the sinusoidal pattern. And then the blue representing inspiratory reserve volume is when we take those big, forceful, deep breaths in, and we drastically increase the amount of air that goes into our lungs. Expiratory reserve, again, is just basically the inverse or the opposite of the inspiratory reserve, as seen in yellow. And then the green representing the residual volume, again, is the amount of air left over after our maximal effort of exhalation. So notice that the residual volume will never go above the trough of the expiratory reserve volume, or the valley of the expiratory reserve volume on the graph. Now, having a pretty good understanding of the 4 lung volumes, we can extrapolate this information and see how it applies to the 4 lung capacities. And again, we're going to use the same graph that we just drew and kind of overlay the lung capacities and see how everything interrelates. So the 4 lung capacities are your total lung capacity, vital lung capacity, functional residual capacity, and your inspiratory capacity. Now, I labeled them 1 through 4 in this mannerism because this is my interpretation of what I think is the easiest to understand of all the capacities. Meaning total lung capacity is the easiest to understand, and then inspiratory capacity might be a little bit harder to conceptualize. So the total lung capacity is literally everything, which makes sense. It's the total It's all 4 lung volumes added together. The vital lung capacity is a full breath in and out at maximum capability. And I think this makes sense in the way that I kind of remember it is it in the name being vital lung capacity. I think that it's vital for you to be able to take really big, deep breaths and exhale all that air that's in your lungs. And again, because it's a full giant breath at maximum capability, this will include your tidal volume, your inspiratory reserve, and your expiratory reserve. And then thirdly, the functional residual capacity is the amount of air remaining in your lungs after exhalation of a normal breath. And for me, the way that I think about this when I hear functional residual capacity, again, I hear that name residual, so I know that it means it must include some amount of air that's left over. Because I know that lung capacities have to include at least 2 lung volumes, I know that residual volume must be in this because it's obviously in the name, and this must include the thing right above the residual volume. And then lastly, coming to inspiratory capacity, this is the max amount of air that you can breathe in at the end of a normal expiration or normal exhalation. And again, inspiratory capacity is kind of just an inverse or opposite of functional residual capacity. Again, I want to emphasize the importance of knowing the lung volumes because once you know the lung volumes inside and out, figuring out the lung capacities is really not that difficult. Try to learn and remember the lung capacities as graphical representations rather than trying to remember, okay, tidal volume plus inspiratory reserve plus expiratory reserve is vital lung capacity. Because once you can visualize and see it, you'll know which lung volumes to include in which specific lung capacities. Stay tuned for future videos as we're going to be taking these seemingly unremarkable lung volumes and lung capacities and demonstrating how they can be very, very useful from a clinical standpoint.